Hello, I said I would follow up with a video after seeing my neurologist, which happened this morning. It was a neurologist PA. My neurologist is booked out until October, so it was my first time seeing her. I also had great luck in scheduling an emergency dental appointment this morning, which followed right after my appointment with my neurologist. And my dentist was very kind and Novocained me for 2 hours of pain relief after my request. So I'll start with the neurologist first. It's really hard when you have things going on with your body that don't readily show up in blood tests and stuff, because it's always a fight and you always have to prove and disprove, and it's so frustrating. And as I'm sure many people on this journey have gone through, healthcare practitioners always think that you're drug seeking, that it's in your head, that you're anxious or you're depressed. I can't even talk normal. She doesn't know that because she doesn't know me, but when a patient presents with obvious pain, then it's not in their head. But I still get frustrated that I continue to go through this with healthcare practitioners, especially when I'm just establishing with them. I went back to my medical doctor after going on this rigmarole of many different things in my health, all ending up being documentable. But until that point, it was always a dispute, and I got tired of being treated like it's in my head, and it still happens with other doctors, but my main primary care physician doesn't treat me that way, so I appreciate that part. This neurologist tried telling me that I had a history of migraines, which I don't. I had one many years ago, back in 2015, and that was after my auto accident that broke my neck, and severe muscle tension and tightness from that, and trigger points took care of it. So I don't feel that having one means a person has a history of something. She told me that my symptoms of TN are not necessarily TN, and that they're kind of uncommon, which I'm having a very difficult time believing because they're all pretty much textbook. She is going to start me on an anti-seizure medication and said that if I respond well to that, then we know for sure that this is TN, that there isn't any diagnostic testing that can be done to prove or disprove it. And the MRI that I had done 1.5 years ago came back normal. I'm pretty sure they weren't looking for a blood vessel on my trigeminal nerve at that point, because they were actually looking for lesions. And she told me it came back completely clear and normal, when in fact it came back with 3 lesions and some other stuff. So whatever. This is why I don't like new doctors at all, because they know it all, and you don't know anything about yourself or your own test results. That's why I always make sure to get copies of my test results. So she's trying that medication. I followed up. Oh, and she's squeezing me in to see my neurologist on July 30th, so he can maybe do injections for TMJ, even though she already said she doesn't believe it's TMJ either. Neither did my doctor. So, dentist ruled out tooth abscess. They took x-rays. There's no abscess. She says if there was, it would have healed up by now, given the fact that I've been on a week's worth of antibiotics. She's quite concerned about the fact that there hasn't been any improvement at all on the antibiotics. My medical doctor said there wouldn't be. If this is a virus thing, if this is my Epstein-Barr virus, it's not going to affect, antibiotics aren't going to affect anything. There is a tooth, my number 16, she had drilled. It was a deep cavity about 3 years ago now, 2015. It broke a portion of a tooth on the back off. So we've been keeping an eye on it. She says there's a little bit of tooth decay present, so just to rule it out, she's gonna have it extracted, but she doesn't believe that's the cause of this pain, especially because it keeps moving around to other teeth, which there's nothing wrong with. And the fact that my pain medication doesn't do anything at all for this pain. She did offer to prescribe me more pain medication, which I turned down because I already take that for my fibromyalgia and arthritis, and it doesn't make any improvement whatsoever. So the tooth is going to be an emergency extraction, 24 to 48 hours for insurance to approve that. Gave me the injection to buy me 2 hours of pain relief, and that's it. The pharmacy still doesn't have my medication ready. Dentist said I should probably wait to start the anti-seizure medication until after I have the tooth extraction done. But granted, that's going to take a considerable amount of time. I might just start it anyway because I would like to be out of this pain. I have a new job I'm supposed to be starting, that I need to be starting, and they're being awesome and working with me, and I haven't even started working there yet. I was supposed to start training for it on Thursday. So right now I have to just check in with them every day, but I need to start feeling better. Or I need to let them know that I can't start at all, because the way that I've been feeling and how sick I've been, there's no way I can go to work like this. I was so nauseous on my way back from my doctor's appointments in Sacramento. It's an hour and a 15-minute drive there and back. So after 2.5 hours of driving and being at doctor's appointments for 3+ hours, I felt like I was gonna throw up everywhere on the way home. It was ridiculous. And yeah, my face is numb, but it still hurts. So this is ridiculous. In my first video, I was like, oh, I'm stoked, at least I can sleep. Yeah, no, not the last 2 nights. I get some sleep, but it's interrupting my sleep now. So I will check back in with the medication. It starts with a T. I don't remember. I know she was going to do the CAR one. I've read that reactivates Epstein-Barr virus, which I have, and I don't want that, and she didn't want to do that to me either. So she said she didn't want to hit me with the big guns just yet. She was going to try this other stuff and at a low dose. So I think it was one of the other lower ones. She wanted to try gabapentin. I don't get along with gabapentin. I've tried it before. It doesn't even help with my nerve pain, and then it causes unwanted side effects. She was going to try Lyrica, Cymbalta. You guys look into what people go through when they try coming off of those medications. They have severe psychological problems. I won't take them. I won't. I know this pain is ridiculous, but I also I'd like to keep my sanity. So there are other medications to try. I will let you guys know how it goes after I start the new medicine, and probably do that before I do the tooth extraction check-in. Okay.